Hello. Thank you for attending today's webinar. Who else is excited? All right, let me see some reactions down there. Hearts and confetti. What is that? Is that one of those things? Anyway, I cannot wait to share this excellent program that we've created and demonstrate how we help support new nurses in the emergency department. By new nurse, I mean the new grad, straight out of nursing school, or even the nurse that is new to the ED environment. So whether your hospital is interested in obtaining our program or whether you're looking to create your own, maybe even revamp what you already have, or maybe you're a new grad nurse or a student and you want to know what you should be looking out for a residency program. Whatever the reason that brought you here, I'm hoping that you can take something away from this webinar to help you be successful in having emergency nurses brought into your emergency department. So feel free to throw your questions in the Q&A. Our team is ready to answer your questions, or you can wait till the end and we can do a quick Q&A. So why don't we get started with some introductions? All right, so on the ENRP team, we have myself. My name is Monica Escalante Colbuck. I am the Director of Novice Nurse Education Programs at ENA. Our team oversees the residency program, our novice pathway, and all things new nurse. I've been an emergency nurse for nearly 20 years, and as a nurse that went straight into the ED after nursing school, I know all too well the challenges and barriers that exist for new grads. Also on our team, Wave, Greta, and Amy. They're both our education program development specialists. These ladies, like myself, are emergency nurses who are still practicing at the bedside. So these two ladies have been working so hard and diligently on the enhancements. They've been doing the lit searches, digging into the evidence, creating the content, and making sure that all you educators have what you need within this program. Katie Ryan is our program specialist. She's responsible for all of our project management of our team. She helps you get your access, assign your licenses, troubleshoot all the things that you need, and make sure everyone's program is running smoothly. She also keeps track of all of our hospitals and keeps us up to date on our program development. So there's Katie, Wave, and then we have Leslie Talbert, who's also our senior administrative assistant. She's the one who's trying to get everybody on our calendars. So she helps coordinate all our on-site meetings and all those logistical needs. She is definitely our swag guru as well. So anytime we show up on site, she's the one to thank to make sure that we never go empty-handed. So our team is here to support whatever it is that you need to get you through the program. Now, what is the point of a nurse residency program in the first place? There's no doubt that nurses need a structured approach. They need a structured onboarding. A well-structured and planned residency program provide new grads or even nurses new to the ED with a supportive transition from academia to clinical practice. They also provide nurses with a better understanding of the ED environment in a more scaffolded way. Additionally, residency programs enhance the overall quality of patient care. They equip new nurses with the skills and confidence to perform effectively. So by fostering a professional development mentality and encouraging a culture of continuous learning, residency programs also help build more competent and dedicated nursing workforce. They can help improve patient outcomes, satisfaction, and actually the eagerness and enthusiasm that new nurses bring can be infectious. Hospitals with well-structured residency programs often have a better reputation and more desirable, they serve as a more desirable employer. So, okay, great, right? They're good. We all want one, but they're a lot of work, like a lot of work. We're going to take a quick poll. So I'm going to pause right here to take a quick poll. You should be seeing it pop up on your screen. Do your ED nurses currently go through a residency program? So I kind of want to see who's out there today and what do you have? So you can go ahead and answer those for me. I'll close it out in a second. Nan, how are the numbers looking, Nan? All right, we're going to close it out in 3, 2, 1.
Are
All
you
right.
able to see the results?
Yeah, why don't you show
Okay,
us the results of
here
that?
we go. Okay.
All right. So, yes, we have a hospital-wide program and an ED specific for about 46%. And about 41% said, yes, we have a hospital-wide program, but not ED specific. We see that a lot. Majority of the EDs that we go to, that this is a reason why they come to us. And then nurses that do not go through a program at all, about 13%. Okay, that's about what we expect to see typically when we talk to other hospitals and talk to the educators that reach out to us. So we know residency programs take a lot of time to develop. I mean, believe me, it's taken Greta and Amy, just the revision piece of it, an entire year to go through all of the content and do the update. But that's where we come in, right? That's why you come to us. So many of you are familiar with ENA's Emergency Nurse Residency Program, or ENRP, as we like to call it here. For those of you who are not, you can scan the QR code, which links you to our homepage, and you can kind of toggle around in there and grab an FAQ document, a flyer. There's links to tons of resources. There's even previous recording of a podcast. So to dive in and get a little bit more information, that's where you want to go. Our program is a turnkey program, so we customize it to fit your ED and your hospital needs. It focuses on helping transition new nurses to competent ED nurses. In our program, we take a holistic approach in making sure that the new nurse is being integrated and onboarded into the ED with all the right education and tools for success. Clinical skills, they're important, so is professional development. And so often we focus on clinical skills and the checklist that we have to do, but we really forget about the other areas of onboarding a new nurse. Social integration, critical thinking, which is huge, and actually confidence. So let's take a look at where we're at. In April, we hit our 2-year mark, and we are currently in 25 states across the US, ranging from critical access hospitals to academic medical centers. This fall, we'll be adding Georgia and North Carolina on our map, so we'll be making it purple. We have educated well over 700 preceptors. We've brought in 1,000 new emergency nurses, and we've created at least 50 plus new program directors who run our program nationwide. We are really proud of the educational reach, but we are also proud that we're contributing to the betterment of our profession. So what is so special about what we do? I mean, can anybody do what we do? Absolutely. Anybody can create a residency program like this, but it takes a lot of work and dedication. What we've chosen to do is a blended approach. So of course, we've done the research, we've explored other programs, looked at who's doing it really well. We looked at ANCC's Practice Transition Accreditation Program, also known as PTAP. We look to them as a roadmap because we really want that high standard for our residency program. So after all of that, we ended up concluding that in order to meet the challenges in the emergency department, new nurses we need to take a more active and hands-on approach to onboarding. So we structured our program to be a blended approach. Residents have a planned didactic education blended with case studies, independent learning, equipment training, clinical skills, all of this tailored to meet the emergency nurse, right? Not the general nurse. What we're learning from our program is that it can be adjusted to help suit your specific ED needs while also being successful. When we first started our program, we were very prescriptive and it should be run this way. But what we're finding out in the past couple of years is that it can be run multiple ways, right? We have hospitals that run a 2-week didactic approach. We have hospitals that spread it out. So in essence, we work with you to make sure that our program is tailored to fit the needs of your department. So there's 2 components. We have the classroom and then sort of the out of classroom. So I'll talk about the classroom components first. We have classroom components that consist of didactic education. Our content is science-driven, evidence-based. All of our content is within 3 to 5 years. of current literature, and we ensure that our education meets the professional association standards, and that, of course, of accreditation programs as well, like the Joint Commission. We include agendas and instructor notes. That's right, you heard me, instructor notes. We have a couple versions. We have verbatim, like, if you're not really familiar with the topic, I would grab the verbatim version. Or we have the bulleted version. So if you're more familiar with a particular topic and a seasoned instructor, maybe you use the bulleted version. So we have the notes that help you deliver the education. Each lecture comes with a list of recommended equipment, policies, and procedures to review. And that's really where you're going to standardize, or I'm sorry, that's really where you're going to make the program specific to your ED, is bringing in your individual policies and procedures. Within the lecture notes are also tips. So that's where we help to remind educators, like, this would be a good time to break and go through the crash card, or let's review some of their standing orders. So every lecture has an accompanying case study. Some of them have 2 to 3. The case studies are meant to be reviewed in class together, and you work through a patient scenario and encourage critical thinking. So every lecture has an associated simulation scenario. The simulations we've created help to complement the learning that's done in the didactic classroom. And it can be delivered low fidelity, high fidelity, tabletop, whatever resources that you have available. Some of our hospitals even use simulations in the classroom to supplement the didactic. So maybe on sepsis didactic, they can do a simulation that day. So whatever works for you. All right, let's see. So all of our, let me show, here's an example of the instructor notes. I want to go back one slide so I can show you. There we go. There we go. Here's a quick look at the instructor notes. So as I mentioned, we incorporate instructor notes and tips to serve as a reminder and to supplement the information. So it's pretty much slide by slide. As you invite others to participate in instructing the program, it's always nice to be handed a script to become more familiar with the content. Instructors will also have their own access of the material, so there's no need to be librarying or sharing the material as well. Here's the didactic topics. So the very first module that we have, the lecture, I should say, is critical thinking. We use the high rate approach for that. Each lecture is formatted in the same approach. Those highlighted in red are new and will be dropping on October 15th to all of our current ENRP hospitals and any new hospitals that join our program. Greta and Amy, do you want to elaborate on any of the topics that you've added? Maybe throw it in the Q&A so that other people can see what has been updated in some of the enhancements for this time. Here's a little look at what we have here. So you see all of them start with agenda and objectives. We take a quick review of anatomy and physiology. This is me going through it pretty fast, so it wouldn't obviously be this fast. And then we go into what does a focused assessment look like for whatever emergency that we're going into, and what might that patient present looking like. We really tried our best to use as much rich graphics as we can. And then here's the high rate approach, where we walk the residents through a structured approach to assessing a patient post-triage. So we have them walk through the assessment, interventions. We talk about diagnostics. And we go into what's the overall treatment, and we talk about disposition. Is a patient getting discharged? Are they going home? We also try to incorporate Real DX videos where we can. Real DX is a company that have people like physicians, paramedics, nurses. They use like GoPros or cameras to get patient permission, and then they record real patient scenarios. So we like to use those case studies as best we can to show our nurses what it would really look like. Here's another look at pediatrics. So this is walking through the high rate. So give a little background on what the whatever the topic is. We go into the history. What are some red flags, the assessment, your interventions, your diagnostics. So those be your standing orders, things like that, treatment, and all the same. All right. Who likes the way it looks? Give me some hearts. Nice. Nice. I love it. All right. For the last day of class, we heard our educators. The putting it all together just wasn't really doing it, right? So we wanted to change it up and give something fun and exciting. So we created what we called the ENRP brain game. For the last day of the class or whenever really you want to run it. The game, it's super fun to play. It's kind of think of it like Family Feud, where you split the room up into two groups or however you want to split the teams up. Each team sends a member up to represent their team at the podium. You can make it fun, get some buzzers. We put up questions and we're reviewing all the didactic material and even the independent study classes and modules that they have. We make it, of course, competitive because we all know emergency nurses are competitive. And you can send us your scores and maybe we'll send you a prize. We don't know. All right. So outside of the classroom, we have simulations, independent learning modules in coaching sessions and reflection sessions. So if simulation wasn't done tabletop during the classroom, it can be done low fidelity or high fidelity in a simulation lab. New nurses also receive independent learning modules that they can complete on their own. These modules are self-paced and are developed with the learner in mind. So we use innovative strategies to make it fun, like gamification. So they feel like they're actually playing a game rather than clicking through yet another CBT. Also, outside of the classroom, our nurses will have coaching sessions with mentors identified at their hospital. We've also included structured reflection sessions. This is probably one of the favorite things by all of the residents. Reflection sessions serve as debriefing opportunities, which I'll talk to you guys about in just a little bit. The last two components help build their clinical skills, their time management, independence, through shadowing and observing different units, but also within the ED as well. So maybe they're following a respiratory therapist or a phlebotomist, or maybe they're going to ICU or OB. All of this is considered outside of the classroom experiences. So here are the list of simulations. What you're seeing in red are the ones that we've added. So now there are 17 simulations that educators can pick from. Can't do them all, that's totally fine. Pick and choose the ones that work best for you and the resources that you have. So currently there are 13, but coming October 15th, all existing and new ENRP hospitals will have access to all 17 of them. Simulations are a great way to incorporate equipment training, hospital policies, procedures, even practice documentation. We love seeing collaboration with other units as well. We've seen someone do bringing in pharmacy, they're running a code and having physicians come in as well. So think about how you can use this outside of the ED as well. All right, and now I want to show something that we've added. So many of you know there's so much education that we want these new nurses to know, and there's only so much that we can do within the classroom time. So we've added some self-paced learning modules. Our educators spoke and we listened. These were the areas that they noticed the program. We noticed in the program evaluations and the feedback from our educators that they were lacking in having this information. So while we go through behavioral health, they just needed a deeper dive. So there's just not enough time in the classroom. So you can see these are all the independent modules that they'll have access to. It'll be up to your hospital whether you want to make these mandatory or and when you want them to do them. We do have a list of recommendation of what order we would have them do them in. The courses listed in red, these are all new. So this is all new for ENRP and it will be available for the residents on October 15th. Majority of the courses listed here do award contact hours. And yes, educators are going to have access to their progress through our learning management system. So they'll be able to export their transcripts and their files. For hospitals seeking PTAP accreditation or who currently have PTAP, these courses can help extend your residency program. But more importantly, these courses are helping the new nurses well past their 16 to 18 weeks, even up to a year. One of the courses, not sure if you saw, but we've teamed up with Apex Innovations. So how many of you, give me a thumbs up if you are already using Apex. Maybe you might use it for the NIHS testing and stuff. Yep, your annual. So we know that new grads, they need that understanding of EKG, of cardiac emergencies. And nobody does it better than Apex Innovations. They use rich graphics, they use incredible animations and bring to life real difficult and hard to understand concepts, but in a meaningful way, and it's interactive. We're also breaking up the content so that our residents can do EKG learning and cardiac understanding in the impulse course 15 minutes a day. All right. As far as our reflection sessions, so this is what I talked about. This is what our residents love doing. So while the independent courses are great and the classroom time is awesome, we want to make sure that the residents actually have opportunities to debrief. So get time in the reflection session to really talk about what they're experiencing, what they're seeing, maybe even talking and sharing their practice in a safe and supportive environment. So reflection sessions encourage empathy. They help build critical thinking. They promote a healthy work environment. All of these things are really significant and important for emergency nurses. Every hospital runs the reflection sessions differently. Some do them every day for 15 minutes, while others may have it weekly. Some schedule them out to have them monthly. It just depends on what fits your ED and your resources. So I know I've been going gabbing all about the resident, right? But there's other roles within our program. So yes, there's the resident, but besides the resident, we have our educator, or who we call the program director. This is the person that's running the show, that's responsible for the program. Then we have instructors, coaches, and preceptors. So instructors, those are just like TNCC and EMPC. We don't expect educators or to have to teach the entire didactic by themselves. We encourage other people to come in. We also have the preceptors and the coach. So everybody plays a significant role in the success of a new nurse coming into the ED. Recognizing that, we wanted to make sure that each of those roles had their own education. So instructors will have education and a track, as we call them, with education to help support them and provide them with CE as well. So here's an example of one, facilitating adult learning. Coaches and preceptors will also have access to additional continuing education hours and education to help support them in their roles. So the Lassiter Clinical Judgment Rubric is what we use for evaluating our residents. And probably game-changing is the introduction to ED precepting. So now you're going to be able to standardize how your nurses are precepting those residents. One of the things I know our team is really, really excited about is we have teamed up with RecMed. For those of you that don't know RecMed, there's a QR code you can go ahead and scan and learn a little bit more about. So another enhancement we've made that we're really excited about is the addition of a resident workbook. Each resident who is in the program will receive this awesome workbook. It's easily over 100 pages. So we teamed up with RecMed to develop a workbook to supplement the residents' learning in the classroom and at the bedside. These workbooks are game-changing. They're rich in graphics. They have learner activities. They really break down medical concepts into simple understanding and help engage them through coloring, right? It's pretty cool. With over 100 pages of information and activities, the residents will have an opportunity to dive a little bit deeper, maybe refresh their memory, or even learn new concepts that didn't quite get to in class. It just offers another way for residents to learn. So we're trying to target different types of learners: auditory, visual, tactile. It's pretty cool. All right, let me go back here. So everything that we've talked about has been about that first year. And one of the things that we did as a team was really look at how do we support that nurse past that first year. Because as we all know, I think it's like 1 in 5 now, nurses leave within the first couple of years. How do we keep them in your EDs? And that's really what we want to do. So I know I've talked a lot about supporting the new nurse in their first year, and I'm hoping that really translate and you guys see through all the enhancement we've made, but we wanted to take a step further than that. We've been really thoughtful about what the new nurse needs. So thoughtful that we pushed the bar and said, why just only their first year? Why not support them longer? So what we've done is we've created more education for them to have in year 2 and in year 3. Anybody like that idea? Can I get maybe some hearts on that one? So for hospitals that are dedicated to the professional development of their nurses, for hospitals that really want their nurses to continue having the support and education past that first residency period, for hospitals looking to extend subscriptions and partner with us for 2-3 years, we've developed educational content to meet the residents' educational needs. So hospitals with 2 to 3 year subscriptions will receive access to curated educational modules to help support the development and practice of the new nurse, not just for the first year, but for their second and third year as well. So here are the courses. So as you can see, we focused on some special populations, but also kept in mind some of the state CE requirements like stroke and trauma. Here's year 3. For year 3, we want to continue supporting the new nurse. The first year, those nurses are residents. They're learning, they're adapting, they're trying to get a feel for their new role, for their practice. By year 2, they're becoming a little bit more comfortable in their practice. They're understanding the ins and outs of the ED and their organization. And maybe now they're even a preceptor. And in year 3, those residents that were brand new are now leaders in the department. They have a deeper understanding of the practice, of their practice, and they begin exploring more specific patient populations and disease processes, or even serving as a coach and as a preceptor in the program. So comes all full circle. Their first year, we see them as the resident, and in that second year, they're becoming the preceptor. And in that third year, maybe they're becoming the coach and helping bring in the new cohort of nurses. Who loves this idea? Huh? Show me some reactions. Nice. Nice. So here's some additional enhancements that we have. Every resident who complete the program will receive a 1-year ENA membership. We want them to be a part of the professional association. We want them to understand what it means to have support, to have access to resources, CE, and to have a network of other emergency nurses. To help them understand their benefits, we're creating short videos that will be dropped into their tracks so they can understand, what do I get out of my ENA membership? So that's for their first year. For the second year, we focus on why attend an ENA conference. You go once and that's it. You're sold. You go every year. And maybe by their third year, they're looking to do some volunteer or get involved in their in really their clinical practice and also in their association. So the third one is on volunteering, whether it's Day on the Hill, the 5K, donations to the foundation. We lay out the various ways that they can help contribute to their professional association. All right, so what are the additional benefits? As our program evolves, we're continuously looking at the content to make sure we've incorporated the most up-to-date emergency practice. We're also considering the organizations and what tools they need to support the program. We also created a media kit. So a media kit is available for hospitals to use to support their program in their organization. We have templated announcements, resources. We provide hospitals with the big pull-up banner to announce that they are a residency hospital that they can use for recruitment, for job fairs. We also incorporate branding guidelines as well for hospitals to use. We've added creative ways really to celebrate graduation as well. We have examples of plenty of schedules, and we've added an ENRP Connect community for program directors that they can talk to other directors across the program. Residents who graduate from our program, they'll get the ENA membership, which I mentioned before, And we also pride ourselves in really getting to know those new grads and encouraging them to participate in other opportunities at their hospital, but also with the association. So one of the last components that I'm sure people want to know is, besides the support that we do, what we really pride ourselves is are knowing our educators, staying in close contact with them. We have the dedicated team that I showed you before. You have direct access to us for whatever it is that you need. We help hospitals develop the schedules. We help hospitals navigate the complexities of starting up a new program. We prepare staff by running preceptor workshops. Some of our hospitals like to debrief with us after each cohort, and we offer on-site visits depending on your needs. As with any program, we're constantly looking at the data, talking to our current hospitals, our educators, and reviewing evaluations to see how can we be improving our program. So I'm sure everyone wants to know what's been the results that you guys have seen. Obviously, every hospital is different, but what you're looking at here, this is the residents' reported confidence level. So we measure their confidence pre-residency, then post-completion. These are great results. These are what we would expect to see. They're feeling more confident in getting a patient history. They still need help identifying red flag. That's completely normal, but we do see an increase in their confidence. This is great news. They also feel stronger about initiating interventions. They're not waiting around for orders, right? They're anticipating what's going to happen. They're anticipating diagnostics and performing assessments. We know that the difficulty is getting them to complete a survey. As tough as I'm sure many of you know, once the nurses are out on the floor, it's really hard to get them to complete a survey and submit their data. So we've come up with some creative ideas and solutions with our new enhancements of how to get them to complete surveys. So hopefully we're going to be having a lot more data coming in this year. What is interesting is you take a look at here as well. So this is how they felt about the program and how it prepared them. Each hospital is obviously different, and we do see retention rates as high as 100% in some of our hospitals and as low as 72% in others. There are a lot of factors tied into why nurses leave, and we'll be looking into those areas a little bit more closely in the coming months. All right, so just to recap, we're really proud of the program that we put together, and we've been very intentional with the enhancement that we've made. There's so much more that I haven't even had a chance to dive into. I wanted to make sure that we had enough time for Q&A. So this is a recap of all of the stuff that we'll be adding. I didn't even get to making the more self-paced, the independent case studies that they have to do on their own. We've made those a little bit more challenging. I didn't even talk about the learning assessments and the quizzes and the readiness exam. We're also going to be changing our evaluation to incorporate the Casey Fink Nurse Retention Survey and creating a program director dashboard so that our program directors can track and receive their own information instead of having to come through us all the time. So I hope that learning more about our program and the upcoming fall enhancements will either provide you with ideas of how to create your own, improve your existing one, or maybe implement ours. We will continue to look at data to make sure that we're always improving the program and meeting your needs. With the limited time we have today, I wish I would have dived more into the Lassiter data management, maybe even PTAP, but we can do that and take a deeper dive into the program. If anyone is going to EN 24, here are the events that we are going to be at. And I would love to see you guys come by, say hello. We are running a preceptor workshop. That's going to be a pre-session on Wednesday, September 4th. On Thursday, I will be talking about our program. And we also have one of our hospitals, Clovis, near Fresno, California, is going to be talking about rolling the dice with a new grad and learning all about how they use the program in their ED. Then we have an academic practice exemplar. That's UC Davis Medical Center in Sacramento. We also have the escape room. So if you want to stop by and do some karaoke or listen to people do karaoke, go through one of our escape rooms. The sign up, I think, is completely full, but maybe get on a wait list. And then Saturday, we also have one more presentation. All right. So who is ready to get started? If you have more questions or you want to take a deeper dive, schedule some time for us to really dive in deeper, do a little environmental scan of your current ED. We can definitely set up a call to do that.
Monica, someone asked if you could go back to the enhancement slide.
Sure. The recap one?
I guess we'll see when you get there. Elizabeth, is this the one you were speaking of?
One of the goals this year too, we want to see this program go international. I want to hear from, and maybe in the chat, is there anybody maybe from the UAE? Are you really thinking about our program? Because we'd love to take a trip out there and get you onboarded. Are there any questions that you want to ask?
So I was answering some in the Q&A, but we can do this out loud.
Sure.
How long is the program and how often do the nurse residents meet?
Did you answer that one, or do you want me to run through it?
I was about to. I just figured we'd do it out loud.
Oh, sure. Why don't you go ahead, Greta?
So honestly, it's very flexible and is dependent on really what the need of the hospital is. The residency orientation itself is 16 to 18 weeks. Having said that, there are independent courses that the residents take as well. So essentially, it could be as long as short as you want it, honestly. But with the addition of the independent courses, and if people are interested in getting PTAP accreditation for the residency program, it should be at least 6 months long. And it can extend into a year if that's desirable. That doesn't mean that they're on orientation for a full year, but they will have content to complete within that year.
Yeah, we have
go ahead.
hospitals that run the program in 12 weeks. We have some that I think University of Vermont is doing 9 months or 6 months. They cut it to
They do 9 months.
9 months. Yeah. Just want to see, maybe other people haven't seen the chat. Do you have a list of hospitals using ERP? Absolutely. Actually, we had a lot of people ask us whose students really were asking what hospitals have the program because they were interested in it. So we created that map that I showed. That is on the ERP landing page. So I can go back to that in case you want to scan the QR code and take a look.
And we did put the link to the map in the Q&A. Katie, do you mind maybe putting that in the chat, the map, so people can access that?
Sure.
And then we do have another question. We currently use HealthStream to track competencies and administer required education. Does this program interface with that program?
Not yet. It's relatively easy. It's through our learning management system. You just log into your ENA profile, and for educators, you can print it out there.
We're getting several questions regarding the use of the program for experienced nurses that are new to the emergency department.
Yes. So this is what the program is designed for. It's designed for new grads straight out of nursing school or nurses new to the ED. So those transitioning to a new practice area. We've had ICU nurses, OB, behavioral health nurses. Greta and Amy, can you guys think of any other ones? I'm trying to think of who else. And they've all been through the program. And, while even an ICU nurse, they may know neurological emergencies, but are they familiar with pediatrics, right? So they still benefit from coming down. Now, would I have a nurse that works in like CV ICU go through the cardiology didactic? Yeah, probably, so that they can see what it is that we do in the ED that may be different. So there's, so yes, it's intended for anyone new to the ED. I wouldn't have like a nurse who's been an ED nurse before go through this, unless they haven't been at the bedside for a while, which we have had that as well. At one of our hospitals in Virginia, we've had someone who's been away from the ED for a while who really felt the program helped them to kind of refresh their memory. Any other questions coming in?
There's a question in the chat about how it aligns with critical access hospitals and their special needs.
Well, oh, I see that one. Okay. Well, maybe you and Greta can answer that from like the content perspective, that it's all encompassing.
Well, I do. Yeah, I just saw Paul. I was actually just thinking of Paul, and he just wrote in the chat. So I was going to say that we actually have someone from a critical access hospital on the webinar today, and he just said it works well. So the program is all encompassing, like Monica was stating. So it really can be tailored for use in any facility. All of the didactic pretty much states, I mean, for example, if you have cardiothoracic surgery at your facility and the other one does not, it speaks to all different aspects within the content. So it can
Yeah.
easily be tailored.
Yeah. So maybe the focus of the lecture, and it has in the lecture notes, it'll say, so if you have to transport a person out, this is the time in which you need to call and get whatever, do the policies and procedures at your hospital in order to transfer somebody out. So we have written that into the instructor notes to be cognizant of, making this fit for critical access all the way up to academic medical centers as well.
So there's a question on the cost. So cost is dependent on annual ED visits. I'll put a link to the form in the chat so you can fill out the link, and then you'll be contacted for further discussion. Oh, thank you, Amy. If you guys want to fill out the form, because it's going to be different, so that will give you more information for pricing.
I see someone asked, how does the ENRP fit together with the ENA modules? I'm assuming they're referring to the ENO modules, which is emergency nursing orientation, which we do in partnership with Elsevier. The ENO modules are a great supplement to the didactic education. We like to use those modules as remediation. So maybe somebody's having a difficult time in cardiology or whatever area. That's where I would come in with some of the modules to help enhance their understanding, their knowledge in a certain area. So the two can be used together. So we have someone from Puerto Rico. Which hospital in Orlando can I enroll? Ooh, someone from Florida is going to have to get our program so we can tell you. We don't currently have a program in Florida.
Monica, can you go to your last slide? For anyone who's curious about next steps or more information on the program, you can utilize the QR code at the end of the presentation or the link that I have put in the chat.
Thank you.
That's where that's where you will go to get in touch with someone to discuss any further questions and set you on your path to next steps.
Yeah. There's a question. We access our ENO program through Elsevier. ENO is different than ENRP. This program is Emergency Nurse Residency Program. I think what you're talking about is the Emergency Nurse Orientation, which are self-paced modules. So that is different than what this program is. That is focused more on orientation, where ours is a complete residency program with onboarding.
Does this program cost typically come out of the ED budget or education department budget at most hospitals?
That's a great question. We have seen so many of our hospitals be very creative with it because while it's ED specific, you can bring in other areas. We have hospitals that use their ED budget, some that even grab money from trauma because we do have a lot of time dedicated to trauma. Some hospitals seek grants or foundation money, or nursing professional development. It really depends on your facility, but we can certainly help navigate that with you. Amy, Greta, you guys want to add anything to that one if I missed anything?
No, I just want to add, if there are some people in the chat, make sure you turn on your chat to everyone, because sometimes it's going to just the host and the panelists. Like Paul mentioned, they look for grants to help as well.
Pamela's asking, can this be used for seasoned nurses from ICU, step down units coming down to the ED? Absolutely. I would have them, probably I would integrate them in with new grads, but I wouldn't have them sit down on every single didactic lecture, but they can certainly benefit from a lot of them. Like I mentioned before, you know, maybe someone who's CVICU wouldn't probably sit in on a cardiology, or maybe they would because they know what they do on ICU, but it's quite different than being in the ED. It just really depends on whether or not your organization is willing to let them go through that residency program. We will have the slides available after the webinar. This also be recorded. So if you want, oh wait, I forgot it's being recorded. So if you want access to this, or you want to share this with anybody in decision-making positions, nudge, nudge, wink, wink.
Nothing else is.
Anything else? Share, I saw on the webinar too, and I have not forgotten about our partners, our pals, our travel buddies, our business development team. We could not run this program without them. So Cheryl, I believe, is on, and Andy is on as well. Steve, Amanda, they have helped to make sure we get this program out as far as we can. Cheryl brings up a great point about funding for it, ED budget, trauma money, nurse recruitment. We've also had our friends in Gulfport, Mississippi. They went through their HR and they received a grant through the state. There is tons of HRSA money out there as well. It's just a bit of work to do the grant writing. But if you need help, just reach out to us. Yep, look for grants. Paul knows. He's done this once or twice before. Anybody else? We want to come visit some cool places. Dubai, that's on my list. Alaska, we love our friends in Alaska. I think as we finish up a little bit, I just want to make sure that we answered all the questions. All right, everybody, thank you so much. I hope that you reach out, scan that QR code, please, and schedule a deep dive with us. We'd love to walk you through the program even more. Thanks, everybody.